Great. Put you down for a question?
Yes, please.
Thanks, David.
Thank you.
Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, March the 1st, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto City Councillor and Chair of the Board of Health, Joe Cressy. Mayor Tory?
Well, Brad, thank you and good afternoon. Black Mental Health Week began today and will run until March 5th. This week is a call to action for more support and access to culturally responsive mental health services and programs for our Black residents. It's a recognition of the impacts mental health problems have on the Black communities, which has been further heightened during the COVID-19 pandemic. Experiencing systemic inequities, discrimination, and microaggressions are social stressors that increase the risk of negative physical and mental health challenges. I have learned from listening what that means. It means that acts of racism one experiences are going to cause you stress at that moment and later. It means anxiety about your kids and some of the discrimination they may be facing at school or in life generally. It means the kind of stress I can't imagine, created by the possibility that always is there that due to the color of your skin, something will happen to you when you go out for a walk or enter a store. Things as simple as that can cause a lot of stress, and this kind of anxiety and stress can and does affect mental health. And that's leaving aside entirely the whole matter of access to mental health supports, which are scandalously lacking in this province as a whole, and even to a greater extent in our Black communities. So that is why Black Mental Health Week is such an important one during which to acknowledge this and to raise awareness. I encourage all residents to participate in Black Mental Health Week by seeking help for mental health care or encouraging someone else to do so, supporting organizations or institutions to adopt a plan to increase accessibility to culturally responsive mental health supports, inspiring community-led activations that advance existing mental health resources within the community, and sharing personal stories so that others in the community know that they are not alone. Details about events happening this week can be found at www.blackmentalhealthweek.ca. My hope is that by recognizing Black Mental Health Week, we can bring awareness about the impact that anti-Black racism has on Black Torontonians, and that we can support our community partners who in turn are supporting Black Torontonians and encourage the development of more support services for people affected by mental health issues. This is consistent with our foundational Toronto values and our goal of moving beyond being the most diverse city in the world, which is a wonderful blessing for us, to also becoming the most inclusive city in the world. Our work to help the federal and provincial governments roll out the COVID-19 vaccine is continuing. While all of our plans are entirely dependent upon vaccine supply from the Government of Canada, we do expect more vaccines will be arriving very soon. The City of Toronto will be ready to get shots in arms, as General Hillier says, and we're working with all of our healthcare partners, including local hospitals, Ontario health teams, local health integration networks, family doctors, community-based health services, and pharmacies to get this job done. Along with our 9 planned city-operated vaccine megasites across Toronto, which we've outlined to you earlier, we expect approximately 49 vaccination clinics operated by hospitals, a further 46 vaccination clinics operated by community health centers, and approximately 249 vaccination clinics operated by pharmacies. So these 350 plus clinics will exist and will be further added to as a result of the work underway to plan mobile clinics and other pop-ups in areas of the city where COVID-19 has hit hard and where vaccination efforts supported by community organizations will be very important. We expect that later today and in the coming days, hospitals, which are not under the control of the city, will announce their detailed plans. This is a team effort, and I believe that the rollout plans we are discussing in detail today show you just how big the team is, for starters, and that, as you would expect, it will deploy its efforts right across the entire city. We are also today publicly releasing our Toronto playbook for the COVID-19 vaccination program. It provides further detail on this effort, including our work to address vaccine hesitancy and to do targeted outreach in communities where it will help us achieve a successful result. As a matter of interest, I had an opportunity to attend this weekend one of the vaccine hesitancy seminars put on by our table of Black vaccine scientists, and it was very informative for all of those who attended. There were many, many questions, as you'd expect, a lot of which would have been asked by many different Torontonians. This will be the largest vaccination effort in the history of the City of Toronto, and I am very confident we will be able to meet this challenge. I know people are tired of the pandemic, and I want it to be over, and they all want it to be over. Everybody wants it to be over. The vaccines represent the best and the ultimate weapon in fighting COVID-19 and defeating it. That's why we have worked quickly with the help of our excellent Toronto hospitals and other healthcare partners to get our most vulnerable residents vaccinated as quickly as possible. It is why almost all of our long-term care and retirement home residents have been fully vaccinated. It's why we are working to vaccinate healthcare workers on the front lines in hospitals, but also midwives, pharmacists and pharmacy technicians, physicians, dentists and dental care providers, and their staffs who provide direct patient care. It's why our frontline first responders are being vaccinated right now. It's why you saw we announced over the weekend that we are starting to vaccinate those residents in our homeless shelters at the highest risk of contracting COVID-19. And it's why, while we wait for additional vaccine supply in the provincial registration system, we are moving to vaccinate people aged 80 and over who attend hospitals for treatment. We are working to get this job done as quickly as possible. I continue to encourage everyone to get vaccinated as soon as they are eligible, and I continue to urge people to keep following the public health advice right now. By staying home as much as possible, wearing a mask and keeping your distance from others, you are protecting yourself and your loved ones. And you are helping us to stop the spread of the virus while we move to roll out the vaccine. Thank you to everyone who is working on the vaccine rollout, and that includes all of my colleagues here at this table today and a huge team of people here and throughout the entire healthcare system. This work is saving lives and will save lives and will do much more than that as it progresses. And thank you to everyone who continues to follow public health advice. You are also doing your part right now to get us to that glorious day when everyone who wants the vaccine is vaccinated and we can safely gather together again. Better days are ahead. A sign of that is the fact that over the last 3.5 days, more than 181 restaurants and bars have submitted registrations for this year's Café TO program. And we have a webinar that's very heavily subscribed, hundreds of restaurants and bars taking place tomorrow, March the 2nd. Now, by way of a brief update on discussions leading up to the March 9th expiry date of the stay-at-home order, I can report that through the weekend and today, I have been involved in detailed, complex, but very constructive discussions with Dr. de Villa and others, trying to determine what would be in the overall best interests of Torontonians. As I have suggested in past weeks, these discussions must include many different considerations. While public health as it relates to the pandemic must be given the highest priority consideration, it is also extremely important that we consider the City of Toronto within a regional and provincial perspective. We must consider the behavior and the mindset of people, the people that we serve at this point in time, and last but certainly not least, the continuing impact of the pandemic on jobs and the economy. This is the kind of broad-ranging discussion we are having with the obvious objective of arriving at an answer which is in the overall best interests of Torontonians, something we've been trying to do on each and every occasion with each and every decision throughout the course of this pandemic. I'd like to now invite Dr. de Villa to deliver her update for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 312 new cases of COVID-19. 298 people are in hospital, and 62 people are in ICU. Sadly, I'm reporting one new death. 1,179 cases have screened positive for mutations and are expected to be confirmed as variants of concern. A week ago, that number was 511. The increase of confirmed variants of concern continues. We have 121 cases confirmed as such. 117 are the UK variant B117, 3 are the Brazilian variant, and 1 is the South African variant. The steady identification of the variants is something we continue to watch very carefully. Vaccination will be vital to countering the continued spread of COVID-19 in any form. And today, I will describe for you the role of Toronto Public Health in vaccination delivery. First, I want to reaffirm the goal and then the resources working to achieve it. As an intervention, the case for vaccines is clear. I've said before, and am happy to say again, that here in Toronto, the reduction of the spread in long-term care and retirement settings tells us all we need to know about the capacity of the vaccines to substantially reverse the threat of COVID-19. While vigilance is required still, the case counts and severity of illness indicate the threat to residents in long-term care and retirement homes is heading in the direction we want, particularly given the heavy price paid in those settings for most of the pandemic. Those results also demonstrate why the vaccination of people on a basis that considers their risk or vulnerability to COVID-19 is the most effective course of action, particularly where vaccinating a population delivers protection and benefit on a widespread basis. From a medical perspective, whatever supply we've got, from a little to a lot, we want to be able to deliver it to people quickly. The sooner we have needles in arms, and the more needles in arms we have, the better off we all are. Many health units around Ontario have started pre-registering residents already. This is a sensible course of action for them based on their size. Toronto is organizing a vaccination campaign within a much more wide-ranging and complicated landscape. For example, our population of people 80 years of age and older is roughly equivalent to the population of the entire city of Guelph. As the largest city in the country, we have much more ground to cover. In this context, we are in active partnership with the healthcare system in Toronto to create as much access as possible, guided by the provincial framework for prioritization for vaccination. As described, Toronto Public Health will deliver vaccines through city clinics, drawing on our experience in mass vaccination campaigns. We will also be able to provide pop-up clinics and mobile clinics, which in practical terms means we'll be able to have mobile teams of immunizers that can be deployed wherever in Toronto they are most needed. To deliver the best and most effective result, vaccination levels must be as consistent as they can be across the entire city. Our data can tell us if that's happening or guide adjustments to ensure that it does. That is a benefit for every person in Toronto. If there are pockets of outbreaks and spread, or places vulnerable to outbreaks and spread, it undermines the effort to reduce COVID-19 to the maximum extent possible. It creates conditions where existing variants can flourish, or worse, where new ones can emerge. Toronto Public Health is a co-chair of the Toronto Health Sector Leadership Table, established to coordinate the delivery of vaccines by the considerable number of organizations that can help to get the job done on the scale we're aiming for. This structure draws particularly on Toronto's hospital system, which has highly valuable capabilities in supporting vaccination delivery, not the least of which are deep and functioning networks into healthcare at the community level, as well as staff who can give vaccines. I'll give you the example of East Toronto Health Partners, the Ontario Health Team that is a group of more than 50 community primary care, home care, hospital, and social services organizations working together to create an integrated system of care. East Toronto Health Partners has already rolled out a pilot program for a mobile team delivering vaccinations to seniors living in high-risk congregate settings. It intends, going forward, to expand direct delivery to seniors through this mechanism. East Toronto Health Partners are also planning to operate independent vaccination clinics in due course, dependent on the supply of vaccine. By working together, Toronto Public Health, with hospitals, Ontario health teams, the local health integration networks, and community-based healthcare providers can significantly ramp up our capacity to deliver vaccinations in Toronto. That said, our ability depends on the supply of vaccine to which we have access. And as supply increases, you can count on knowing there are systems and people in place ready to deliver. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. Our coordinated enforcement teams continue to work diligently to enforce the regulations relating to COVID-19. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result, 2 charges were laid against the owner and operator of a personal service salon. Also, 1 charge was laid and a temporary closure order was issued against 1 restaurant and bar. Following response and investigation by our municipal law enforcement officers and Toronto police officers, 15 charges were laid over the course of the weekend as a result of large gatherings on private property and in private residences. This weekend, Toronto Police also responded to an anti-mask protest at Queen's Park, resulting in 2 charges being laid under the Emergency Management and Civil Protection Act and 1 charge being laid under the Criminal Code. I would like to extend my thanks to each of our enforcement officers who do their very best to meet the challenges associated with the enforcement of COVID-19 regulations each day. I'm also pleased to provide an update this afternoon on Immunization Task Force operations. Our Immunization Task Force continues to be hard at work, preparing for the arrival of additional vaccine in the coming weeks. I'm pleased to report that we have completed the setup of 5 of our city-operated COVID-19 immunization clinics, each of which is ahead of schedule. The clinic locations in the Metro Toronto Convention Centre, Malvern Community Centre, Toronto Congress Centre, the hangar in Downsview Park, and now the Scarborough Town Centre locations, have been assembled and are prepared for the commencement of operations when the time comes. We are now working on setting up the Mitchell Field location, with the North Toronto Memorial, Carmine Stefano, and the Cloverdale Mall locations to follow shortly thereafter. The proactive setup of these clinics is being completed ahead of the anticipated activation date in order to ensure that the city is ready to respond as very soon as vaccine is available. We are also continuing to recruit, onboard, and train the nearly 1,400 staff that are required to operate these clinics. Delivering scalable solutions has been a fundamental objective for us from the outset of Immunization Task Force operations. We are continuing to proactively plan for the potential expansion of immunization clinic operations should the demand-based need arise, should vaccine availability permit, and should the Province of Ontario direct us to do so at some point in the future. Scalability and responsiveness are key aspects of any successful incident management system, and these objectives have guided our planning and response since the outset of COVID-19 response in Toronto. The 9 city-operated COVID-19 immunization clinics form the backbone of the network of city-wide clinics and locations that will eventually be available to residents. We continue to work in collaboration with the Province of Ontario and our many healthcare partners in planning for this eventual network of clinics, which Mayor Tory outlined. The operational plans for our 9 city-operated COVID-19 immunization clinics are informed by the lessons learned during proof-of-concept operations in both January and February. During the proof-of-concept clinic, held in the Metro Toronto Convention Centre location, we had the opportunity to evaluate the requirements and functionality of all aspects of clinic operations, including the COVID-19 scheduling system. The results of these proof-of-concept evaluations confirmed that the successful deployment and operation of COVID-19 immunization clinics of this size and scope in a city as large as Toronto requires a robust, centrally coordinated scheduling and registration system. This need is amplified in consideration of the need to maintain strict compliance with the provincial vaccine prioritization framework. Accordingly, our proof-of-concept observations and lessons learned were shared with our provincial partners, and we have continued to work closely with the province to ensure that the system that they will launch on the 15th of March will meet our collective needs. I'm pleased that the provincial system is now undergoing pilot evaluations in a number of smaller jurisdictions in Ontario in preparation for province-wide launch later this month. The approval of the AstraZeneca COVID-19 vaccine by the Government of Canada brings with it excitement and hope for an expedited rollout of vaccine across Toronto. We are working every day with our provincial partners to ensure that we are able to make vaccines available to everyone who wishes to receive one as very soon as possible. The city asked that residents not call 311 to inquire about booking vaccine appointments at this time, and that they not attend any of the clinic facilities until such time as they have a confirmed appointment. As vaccines become available, information will be shared about prioritization and how to book an appointment. The work of our immunization task force is ongoing 7 days per week in our city, and we won't stop until we have completed our mission and until COVID-19 is behind us. I thank everyone for their continued patience as the situation with vaccine availability continues to evolve. And I continue to encourage everyone to monitor toronto.ca/COVID-19 for the most accurate and up-to-date information relating to both COVID-19 response and vaccine in Toronto. Thank you. I'll now invite Councillor Cressy to bring his remarks.
Well, thank you, Mayor Tory, Chief Pegg, and Dr. de Villa. I'd like to take a moment to discuss our plans for a community-based vaccine campaign to support vaccine uptake, to tackle vaccine hesitancy, and to engage targeted hard-hit communities. Today, we are announcing details of the largest community mobilization plan in our city's history. At a high level, manufacturing a safe and effective vaccine is only the first step. Ensuring it is available and accessible to every single resident of our city, well, that's now the task at hand. So what's the objective? The science tells us we need to achieve herd immunity through mass vaccination. In other words, we need over 70% of the population to get vaccinated to truly beat this virus. So we need a vaccine plan that targets people everywhere, where you live and where you work, where you pray and where you hang out, whether you're on your phone or whether you're in person. Our plan is fundamentally about building trust and ensuring access. It's grounded in community. We are partnering with community agencies and local neighborhood leaders on the ground in every corner of our city in order to reach every resident in our city. So there are 3 components of this community mobilization and targeted outreach plan that I'd like to tell you about today. First, neighborhood ambassadors. We're bringing on board 280 neighborhood ambassadors to promote vaccines in their community. your local priest or your pastor or your rabbi or your imam, your barber, your crossing guard, the kids' soccer coach, trusted local leaders to help make the case, provide information, and help their neighbors access the vaccine. That's what 280 neighborhood ambassadors will do. Research has long shown that when it comes to vaccines, people are more likely to take the time and to take those vaccines when it's people they trust who are making the case, whether that's your family doctor, your local faith leader, or just a member of your extended family. Our 280 neighborhood ambassadors will be on the ground in their communities to make the case for vaccines. The second component of our plan is a partnership with community agencies. The City of Toronto will be partnering with 140 community agencies alongside a select number of anchor agencies to mobilize vaccines in their neighborhoods. You know, government works best when it's rooted in local neighborhoods. We know this. So we're launching an unprecedented campaign to mobilize community organizations in our vaccine campaign. Trusted local community organizations to go door to door to promote vaccines, to confront vaccine hesitancy, and to help us identify and organize locations for mobile and pop-up sites that are needed. And the third component is targeted outreach in hard-hit communities. You know, we've long said that when it comes to COVID, we're not all equal. The data has made this abundantly clear. And so an effective campaign for vaccines requires tailored approaches to engage different communities. This is the very opposite of a one-size-fits-all vaccine approach. So we previously told you about Toronto's Black Scientists Task Force and our vaccine plans working with and to support the Black community. City staff are now also hard at work working with local organizations, creating specific campaigns for Toronto's Indigenous community, our South Asian community, our Muslim communities, our senior communities, and persons with disabilities. Work is already actively underway on the ground with these communities, and more details will be shared in each case in the weeks ahead. Listen, I'll simply close by saying, as Torontonians, you've gone through a lot this past year, and we've all gone through too much to come up short now. Our vaccination campaign is the largest undertaking in our city's history. Every neighborhood, every community agency, every resident must be a part of it. You can think of it almost as an election, but in this case, we need to win more than 70% of the vote, and we need absolutely everyone working together on the ground to get residents to the polls, or in this case, to the vaccine clinics. And so listen, our residents are counting on us and working with our federal and provincial partners. Our city will not let you down. With that, I'll turn it over to Brad Ross, and we can open it up for questions.
Thank you very much, Councillor Cressy. Before we go to questions, just a reminder to reporters to please unmute yourself when I call your name. We'll go first now to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Thanks, Brad. Good afternoon, everybody. My first question is for Dr. de Villa. My colleague Anthony Fury submitted an inquiry to Toronto Public Health over the weekend in relation to directives published by Peel Region directing small children dismissed from school for being exposed to a positive COVID-19 case be placed in solitary isolation and quarantine. The response that he got from your office was pretty ambiguous and suggesting that a caregiver can be isolated with the child, but the two must still be isolated from the rest of the family for 2 weeks. Keep in mind, these aren't kids who have tested positive or show symptoms, but they are may have been exposed. Brampton Mayor Patrick Brown has spoken out against this, and your counterpart in Peel has chosen to remove the flyers from circulation, all the while some parents are speaking out, claiming that they've been previously instructed by Toronto Public Health to isolate their kids under similar circumstances. I'm hoping, Dr. de Villa, you can clear this up and let us know what Toronto Public Health stance is on isolating asymptomatic and untested children from their families.
Thank you for the question. Unfortunately, I haven't had the chance to see the inquiry come into the office, nor have I had a chance to take a look at the materials that you're speaking of. But I think, what I can say at this point is that in these kinds of situations, what you're trying to do is to effect as good and safe an isolation as is possible. The ultimate goal is to try to reduce the spread and the transmission of disease from one person to the next, but to do so in a manner that's safe, for all those involved. Clearly, with young children, they're going to need the support of their parents and their caregiver, to make sure that they've got, the necessities of life and that they're well and appropriately cared for. The manner in which that is done will help to ensure the safety, yes, of the child and all those in the household, as well as the person who is the direct provider of care.
Okay, thanks. My second question is for the mayor. The city released its December numbers for the automated speed enforcement program today, showing a dramatic increase from November's numbers, up from 721 in November to over 22,000 in December. The numbers are on the decline since the program's launch in July. What are your thoughts on this?
Well, of course, the cameras were all moved, and so you would expect, I think, to see a pattern, not that you'd hope to see it, but you'd expect to see a pattern that we saw before, which is the cameras in their new locations are going to see a high number of people getting tickets, and what we saw in the old locations was each month that passed after the first month, the number of tickets got less and less as people figured out that if they were speeding in those places, they were going to get a ticket. So I'm not surprised that the number in this initial month in these 50 new locations is high. What I continue to be stunned at, quite frankly, is that there would be examples like one person getting 15 tickets on 2 different streets in the same neighborhood in Etobicoke, or somebody in Scarborough going 99 kilometers per hour on a 50-kilometer speed limit zone. These are the kinds of acts of irresponsible behavior that we're trying to stop. I think automated speed enforcement is going to help us with this, but we will see, and I hope, a gradually declining number of tickets given in these 50 locations, and then the plan would be to move them to another 50 locations sometime going forward.
Right, thank you. We'll go next to Jason Chapman from AM 640. Jason, go ahead, please.
Hi, Brad. Thanks for the question, guys. I have to follow up. I wasn't going to go here, but I have to follow up on Brian's first question. I've got young kids at home, so it gets personal. But Dr. de Villa and Mayor Tory, I'd actually like you to both to weigh in on this. Are you saying it is a good idea for kids, one kid and a caregiver, to isolate in a part of the house if they're asymptomatic for 14 days? So you take a mom and a daughter and you put them in a corner of a house. And remember, we're in Toronto. We got lots of people who live in tiny houses. So you put them in a corner of a house, and you're saying that is healthier than letting them mix with the family. I want to get really clear on this, because I think the writing that Peel took and crafted their pamphlet out of could be construed to say a whole bunch of things. So I want to really understand, is it healthy to put a child and a parent in one room of a house for 2 weeks?
So why don't I start off with this? Again, without having seen the materials, it's difficult for me to comment specifically on the materials. I believe the situation that we're speaking of here, though, is, a situation in which you have somebody who is at high risk of potentially developing an infection with COVID-19 because of a given exposure. I would have to imagine that that's the circumstance we're talking about here. And we're talking about a child, a young person, who clearly needs support in order to, have all the necessities of life. And, our responsibility in local public health is to help these individuals establish a safe and effective isolation so as to reduce the likelihood of transmission from one person to others, including others in the household. So optimally, that can happen within the context of your home, because you have all your amenities and all the things around you, plus your familiar surroundings, probably important, especially for a young child. That being said, in order to try to effect good isolation for people, we have tried to provide supports to the greatest extent possible. Some of them are in-home supports to families. Others are through the establishment of the Toronto Voluntary Isolation Centre. These are the kinds of supports that we've put in place as Toronto Public Health to help individuals in our community so as they can effect an appropriate isolation or quarantine, as the case may be, and reduce the transmission of COVID-19. But a safe and effective isolation is, yes, about reducing the spread or the transmission of COVID-19 from one person to the next, but it's also about making sure that people have all the necessities of life, access to appropriate food, medication, etc., whatever their circumstances require, so that they can, manage in that time period that they need to sequester themselves and limit their interactions to the greatest extent possible to reduce the spread of the disease. This will be especially important if in your household you have members of the household who are especially vulnerable to more severe outcomes associated with the COVID-19 infection. Grandparents would be a classic example.
We have made real efforts as a city and on the advice of our medical officer of health in providing things like isolation sites where people can go that live in circumstances where it's not possible for them to isolate. But I think whatever piece of paper, whatever isolation site we make available, there's no substitute for common sense. And common sense says that you make whatever effort you can with whatever support you have available. And if you live in a 500 square foot apartment, then you try your very best, as we would all go through with other kinds of contagious diseases, less serious. There's more at stake with COVID-19, and especially more at stake as regards, say, elderly people who might share that house. So I think we would expect that people would do whatever they can and isolate as best they can somebody who's sick from somebody who's not. But common sense, again, is going to dictate a lot of what is possible and what people should do. And I'm sure that most people are able to apply common sense as best they can.
That's a perfect springboard for my next question. It's common sense. I know that no decision apparently has been made on this stay-at-home order for the City of Toronto yet. But Saturday was a beautiful day. People were out all over the place, whether it was in Toronto or whether people got in their cars and drove to Oakville to walk around downtown Oakville because we can't go shopping in Toronto. So I read a couple of think pieces I wanted to get Dr. de Villa and Mayor Tory's thoughts on. Is that as we get into nicer weather, I know it's miserable out today, but Wednesday looks beautiful. Does it not make sense to move forward with a more common sense approach on advice? Not stay at home, but recognize that there are low risk scenarios for people to give COVID-19 to one another. That, if shop owners as well want to open and allow one or two people in at a time, it's very low risk. This is what we're hearing more and more about COVID-19 with the variants or not with the variants. So I ask for your comments, Dr. de Villa and Mayor Tory, on does it not make sense to move into a more common sense approach that lets adults get out? Because they were out, they weren't staying at home on Saturday. That lets them go out in responsible ways instead of hiding indoors where transmission is much more likely.
So why don't I start off, to address the question. And, I would say this, that, the mayor makes good comments about the use of common sense, and you've addressed, the application of common sense. And I would suggest to you that that's exactly what we have sought to do throughout the entire course of the pandemic. It is an application of the best available science and evidence, the experiences that we've had ourselves, that which we've seen from other jurisdictions, and yes, common sense. So we know that taking all of these things together, that the risk is significantly reduced in the outdoors, and you've heard us speak of this many, many times, that, with distance and wearing your mask as much as possible and in large open air spaces like, is provided when you're outside, you certainly reduce risk. That's true, but that doesn't take away from the fact that the more we are able to reduce the interaction that we have with other people, particularly those outside of our household, we are also able to reduce the spread and transmission of disease, whether we're talking about old variants of COVID-19 or the new variants of COVID-19, which we know are more transmissible. And we have increasing evidence that suggests that certain variants, particularly the UK B117 variant, that one has been associated with more severe outcomes with those types of, with B117 infections. So all of these things taken together, I think, should be taken, and reflected in the actions and in the advice that we're providing to you. So absolutely, risk is definitely reduced outdoors. However, that doesn't take away from the fact that reducing our interactions with other people, particularly those with whom we don't live, you wearing your mask as much as possible, all the self-protection measures you've heard us talk about time and time again, these things all together actually will provide the best protection until such time as vaccine supply is more available, we get more vaccine coverage, And then again, we can, start to imagine and start to experience life a little bit more like what we used to know before there was a COVID-19. Hand it over.
Jason, I think we want to use common sense and we want to use the maximum amount we know in order to make sure that we keep people safe and avoid the one thing that I think people would be unanimous in saying they don't want us to go anywhere near, which is another lockdown sometime down the road. And so I think if we take into account health first and foremost, because we have to do that, and then combine that with the state of mind of people, and that's an important consideration in terms of people complying with the health restrictions, the regional world in which we live. Toronto is not an island. Toronto is a big city surrounded by regions of people that are in somewhat different circumstances than we are at present. And then finally, and last but not least, the economy and jobs. And I think if we take all of those into account in a common sense way, with the obvious first priority being to keep people safe and to avoid a further lockdown later, we will be able to come up with something that will serve the city and all Torontonians well, and that's our job.
Thank you. We'll go now to Matt Bingley from Global News. Go ahead, Matt.
Hi, if I could follow up on the question everybody's been asking about so far. Dr. de Villa, when it comes to the isolation of a child, just looking at the city's advice, the TPH advice for self-isolation, it doesn't make the distinction about what a caregiver should be doing on the website. And this is where I think a lot of the concern has come from in Peel, is that there was an omission of the fact that a caregiver should be included on some of the literature that went out. So I'm just wondering, Public Health Ontario is the same way with its website. It also omits this key detail of if you do have to isolate with a child, that you should be having a caregiver with them. I'm just wondering if you feel that there needs to be more clarification for the public who's looking at this, because I have been in contact with a parent from Toronto who was told to basically put her daughter in a separate room for quite some time.
So, Matt, thanks for the question. I would suggest that, given the number of questions that have come from the media here today, and presumably questions that are coming from members of the public, it's always worth reviewing our materials to see, whether they're, achieving their intended goal or objective, and if there is need for further clarity. I think that's part of our role in public service. We're constantly trying to do the best we can to serve our population, and if that means enhancing or improving our materials for clarity in particular, I'm always happy to do that. So I will certainly ask the team at Toronto Public Health to do that. I would say this. Again, the notion is to provide as safe and effective an isolation as is possible. I know that in the context of the conversations that we have in case management at Toronto Public Health, there is an opportunity, certainly as we speak to our clients, to have those conversations and for them to raise their questions. We, of course, also have a hotline where we're prepared to answer questions for members of the public. And that's a service that's always available. So if there is need for further clarity up front, certainly happy to do that and to take a look at our materials to make sure that they're achieving their intended goals and objectives. But of course, we are open to receive questions from the public, and we'll seek to address those in the unique circumstances of individuals as they ask their questions.
Thank you for that. And just to follow up before you put your mask back on, I just wanted to ask about the variants and trying to get more detail on how many of them are active cases, because we're seeing obviously a lot of them get globbed into this screened positive category. And I'm just wondering if there's an opportunity to provide more clarity on the TPH website for future cases as to how many active cases there are, because there are a lot of people who are looking at cases going down and it's all getting sort of lumped in with that daily case count. So is there, can you just tell me how many active VOCs there actually are in Toronto right now? And if you could follow up on that second part as well about providing more clarity in the future.
Well, certainly we're, as I mentioned in respect of your earlier question, we're always trying to provide greater clarity to the public, especially in our materials, whether they're on our website or whether they're various forms or fact sheets and FAQs in order to help people understand the circumstances. So certainly happy to do that. I can't tell you off the top of my head how many active cases. I can tell you when I've looked at the website, and I did look at it earlier this morning, a number of those screen positive cases are recently diagnosed and therefore are likely to be active, but I don't have the specific numbers for you today, I'm afraid, Matt.
Okay, thank you. We'll go next to Mark McAllister from City News. Go ahead, Mark.
Thank you very much. Wanted to ask a follow-up question, Dr. de Villa, to a point that you had made about collecting data through all the vaccinations and the plan moving forward and allowing that to adjust things on the fly if need be. You're talking about 350 clinics now in the city in addition to the mass vaccination clinics. We've got all these different demographics that are going to be serviced within different phases. You've now announced neighborhood ambassadors in certain neighborhoods that have to be taken care of first. Explain that data that you'll be collecting and how things can be adjusted on the fly should they need be.
Sure. So, Mark, as it turns out, one of the systems that has been taken on by the provincial government in respect of this COVID-19 vaccine campaign is the development of what they call COVAX On, and that's the information system, and it is a provincial system, and it is province-wide. And it's in that system where the data around, who's received vaccine, what vaccine they've received is actually being recorded. So there you have an opportunity to understand who has already received vaccine and from which neighborhoods or parts of the province, as it turns out, they come from. So here you have an opportunity to determine where does coverage look like it's pretty good, where does it look like it has an opportunity to be improved, and therefore, as vaccine clinic planners, whether you're the local public health unit or working in a hospital in partnership with local public health or any other community agency, we have the opportunity to plan for community clinics or for vaccine clinics to be set up and directed towards those areas that clearly need more access or need to see greater uptake.
Thank you. Specific to the release from yesterday that there would be a focus on vaccinating the homeless in our city. At this point, obviously there's still a limited supply of vaccines. So how do you coordinate adding yet another group of people to an essential list that we know of already that had another age group added last week? How do you make sure that you can accommodate all of these people now that you've added yet another group? Do you prioritize those that are already in priority groups in phase 1?
So, Mark, in respect of this issue, and you're right, supply is a challenge that needs to be overcome, and it is our sincere hope that this is something that's overcome sooner rather than later. The whole purpose of the work that you've heard many of us here describe today is to ensure that there is an entire system in place here in this very large city to make sure that when vaccine supply does become available, we are, able to quickly get needles into arms and into as many arms as is possible, because we know that that's a significant component of our response to COVID-19 and moving beyond the pandemic, putting this pandemic behind us. So when it comes to our clients in shelters, we are actively working with our healthcare partners, notably those who actually provide clinical care and service to shelter clients. They're the ones who are closer to the ground, along with shelter service providers. They can tell us, as local public health and the other partners who are involved with the vaccination of shelter clients, where are the risks the greatest? So we can then prioritize, the current supply of doses that we have right now, recognizing that, yes, there are a number of different subpopulations that we're seeking to reach as part of phase 1 under the provincial framework. But you're absolutely right. The more free-flowing vaccine supply comes, the easier it becomes for us to really start addressing needs across the broad range of populations that are in phase 1, and to go beyond that and really start getting coverage across the city. Hence the very well-developed health sector and community partner relationships that we're fostering to really put as many needles into as many arms as fast as possible.
All right, thank you. We'll go next to Natalie Johnson from CTV News. Go ahead, Natalie.
Hi, everyone. I think it's fair to say there's still a lot of questions as to how the vaccination plan is going to play out for seniors 80 and up in Toronto. Can you provide more specifics on when and where and how seniors 80 and up will be able to get the shot in Toronto? How will they sign up? When and where are they going to get it?
So why don't I start off, Natalie, and you know, if there are others who would like to chime in, we'll give them that opportunity to do so. So, you know, you're quite right. We're a big city, and it is, you know, an interesting undertaking and a complex one for us to undertake, you know, as Toronto Public Health and as the City of Toronto in partnership with health sector partners. As I mentioned earlier, our 80-plus population in the city is as big as the entire population of the city of Guelph. So this just gives you a sense as to, you know, the scale and scope of the undertaking that we're talking about here. So first and foremost, what we need is vaccine supply in order to cover that population. Keeping in mind that at the same time, in this phase 1 population, we're accounting for you know, those, and we have accounted for those who are in long-term care, residents, staff, essential caregivers within long-term care. Same for retirement homes. We also know that we've got, you know, about 100,000 people working in hospitals, just off the top of my head. So we have a number of healthcare worker populations that we need to address as well. So when I think about healthcare worker populations here, when you think about the total number, for example, of physicians practicing in the province of Ontario, just about half of them are actually practicing here in the city of Toronto. So those are just our healthcare workers. We were talking about long-term care populations and retirement home populations. These all need to be done, and you're quite right. We've got the 80-plus population that is also meant to be accounted for at this stage in our vaccination undertakings. And many other jurisdictions, smaller than Toronto, are able to do so now. We are working with our hospital partners to try to identify, and they're already working on that this week, to start off with certain subpopulations of those who are 80 years of age and older. Those who have strong relationships and existing visits to hospitals will, you know, be a good place to start. But obviously what we're waiting for are larger supplies of vaccines so we can get to that very big group here in Toronto, roughly about 120,000 people who are 80 years of age and older. And what we need to do that is a strong supply of available vaccine.
Did you want to add something?
I understand that the supply.
Just 1 sec, Natalie. Chief Pegg's just going to follow up on that, and then we'll go to you, Ken.
Natalie, I'll just reiterate some of the things I mentioned in my earlier remarks. So when we launched the proof of concept clinic at the Metro Toronto Convention Centre in January and then again in February for second dose proof of concept, one of the things that we had the opportunity to evaluate, I would say fully, was the functionality and the requirements for a scheduling system in consideration of clinic operations that are as large as what is being planned here in the City of Toronto and in an environment as large as the City of Toronto. It was immediately clear to us in the post or the after action analysis of the proof of concept clinics that what is required in order to do this successfully and to do this, to manage this in both an effective and an efficient means, is a centrally coordinated, robust scheduling system. That is in fact what the province of Ontario undertook at that point to move forward in developing, and like we saw in some media announcements this morning, we're really encouraged by the fact that that scheduling system is now being piloted. There are actually proof of concept operations happening in a number of smaller jurisdictions. We will leverage that system once it's turned on. The date that's been provided to us is the 15th of March, and that date times well for us, given that the operating date or the forecasted commencement date for our operations is early April. Those forecasts are directly tied to the availability of vaccine. So once the scheduling system goes through its proof of concept that it's happening now at the province and it's live, we will be provided with all of that information from the province of Ontario with respect to all of the questions you asked, the when and the how and the where. And we will undertake, of course, in collaboration with our partners at Toronto Public Health to communicate that clearly. But that system is the right answer. We're looking forward to seeing the results of the provincial testing that's ongoing and seeing it go live.
Mayor Tory?
Just to say that we have to have the cooperation of people. We have to have done this in steps. We had to put in place the kind of infrastructure, as it were, with the 353 clinics and the community efforts that are going to be made, following which we have to have the supply and the provincial information system, which will be, we're being told on the information system 2 weeks from today. And we're asking people in the meantime, please not to come to any of the places where we've announced there are going to be clinics because they're not open yet. And we're asking people not to call even the public health hotline or the 311. At the moment, there will be a place to call, a phone center, as well as an online opportunity to register and to get scheduled so that people can get answers to the question when, where, by whom, which can include everything from a pharmacy through to a community health organization, through to a hospital, through to one of our mass immunization clinics. And the job one that we had to do, which is well advanced and I'm very confident will be ready whenever the supply is there, is to put that infrastructure in place with our health partners. And people will then find that there's a massive public information campaign being run both by the province, the Premier told me that last week, and by us in a multiplicity of languages so that people will know the answers to the question when, with whom, where, because we understand those are questions at the moment that don't have answers people know. I should just say that in meeting today, as I did at lunchtime with all of the mayors from around the Greater Toronto and Hamilton region, the fact that different people are at different stages. In our case, we're working through a much larger number of long-term care residents, for example. We've done that successfully. We have about half of all the doctors in Ontario reside right here in the city of Toronto. So we have a much larger task to perform in the context of getting through the healthcare workers and the other top priority people as set out by the province in their priority list, and we're doing that. We will do that subject to supply, and then it'll time out quite nicely with the availability of the information system to answer the sort of when, why, and where, and by whom, which will come very soon into March.
Do you have a follow-up, Natalie?
Yeah, so just so I'm understanding this, are you saying that it will likely be April before the 80-plus population gets their shots or starts to get their shots in Toronto? And just secondary to that, is there a plan in place for those who are homebound?
So Natalie, I think what you're hearing from across the table here is that we need supply to be more readily available to get into the large-scale administration of vaccine for that 80-plus population. But that doesn't mean it's not starting until April. In fact, there are a number of vaccine initiatives that are underway right now. Mayor Tory just spoke of the long-term care and retirement home vaccination campaigns that have successfully been undertaken. And I mentioned in my remarks some of the vaccination efforts that have been undertaken by just one group. That's the East Toronto Health Partners. They've started undertaking some vaccinations within high-risk congregate seniors living places, and that would include certainly a significant number of people who are in that 80-plus population. So we are, endeavoring to take care of that population in ways that we can until such time as a more plentiful supply of vaccine is established, and we're really looking forward to that so that we can start to do that bigger lift for that plentiful population, which I said is roughly about 120,000 here in the city.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Good afternoon, everyone. I just wanted to ask first about prioritization of high-risk communities. I know Councillor Cressy spoke about some of the efforts being made there, and Dr. de Villa, you also mentioned mobile clinics. Just in terms of the report that the province's science table put out, looking at the benefits of tackling both age and postal code, I wonder if there's anything the city can do when it comes to putting mobile clinics in those areas that involves not just following the provincial age rollout. So what I mean by that is if you're going into a high risk community, can you only vaccinate, 80 plus to start, and then 75 and then 65, or can there be a bit more prioritization there to benefit the whole city?
So I think that what you've heard us speak about thus far is in direct keeping with what the Science Advisory Table had spoken of, that we need to think about how do we provide protection, how do we quickly provide the protection afforded by vaccine to those who are at greatest risk or who perhaps most vulnerable to negative outcomes associated with COVID-19. That's exactly the kind of thing that we're taking into consideration in our planning. We do have to work within the context of the provincial framework for prioritization, but within that, we've started with, that 80 plus group that's been articulated in the provincial framework, and we can also look at how best do we make sure that our clinics are serving those areas of the population, looking at age, and yes, looking at where disease has been particularly prevalent and those areas of the city that have been hardest hit. We do know that we've got clinics established, mass immunization clinics established to cover the broad geography of the city, and as I mentioned in my remarks, we have the opportunity to focus our efforts through mobile clinics, and that's just the city's efforts in and of themselves. This does not speak about that which our health sector partners and our community partners will be seeking to do in order to provide vaccine and access to vaccine in those areas of the city that have been really hard hit, but are still consistent with the provincial prioritization framework. Hence, as Councillor Cressy spoke to, there have been efforts to work with community ambassadors, to work with community agencies, and to really focus on access for certain neighbourhoods, particularly those that have been hardest hit. Councillor Cressy may have more to add.
Well, just very briefly, Jennifer, I think a lot of the discourse today and in the days ahead is in the context of having limited supply, and thus how do you roll it out as quickly as possible to those most in need. But keep in mind, in very short order, we're going to be in a scenario where we're going to have supply. And then the conversation turns to how do you ensure that it is accessible and available to every corner and to every resident in this city. And so it's on that basis that a lot of the details and the plans being put in place here with 140 community agencies, neighborhood ambassadors on the ground, mobile clinics, pop-up clinics, all of this is building the infrastructure to ensure no matter where you live, where you work, no matter what color skin you have or how much money you earn, that we're going to have a vaccine plan there that's available for you. And I think right now we're all talking about how do we deal with limited supply. Well, in short order, we're going to be talking about how do we make sure that everybody who needs it can get it. And that's what we're quickly planning and working towards.
And then just to kind of follow up on some of Natalie's questions, I know there's still work being done on how exactly people will get vaccinated, but I wonder about the city's role in informing people it's their turn to get vaccinated beyond, advertising campaigns, which I know the city's public health is already doing. Will there be letters to people? Will there be other direct communication with people letting them know how and when and where they can be vaccinated?
So, Jennifer, I think that it is going to require, a multitude of different methodologies in order to ensure that people are aware. Although I will say this, Based on the activity that we've seen thus far, there appears to be no shortage of interest, including amongst those who are 80 years of age and older. And I'm actually really pleased to see that. That is really good news. It means that people are interested, they're paying attention, and they're quickly trying to pick up information and seek out opportunities to get vaccine, which bodes well as vaccine supply starts to become more available. So certainly, we use these briefings as one method, but there are several other channels that we will use, and that certainly one of them will include the active engagement of our health sector partners. There are a number of communications tables that are actually happening, and we rely on those who have established relationships of trust with people throughout the community. We know, as Councillor Cressy mentioned in his remarks, that that's perhaps the most effective method by which to encourage people to go out and seek opportunities for vaccine. So whether we're talking about pre-existing relationships with healthcare partners, whether it's through community agencies and the community ambassadors that are being brought on board, whether it's through traditional mass communications methodologies, I think you can count on us using any available channel and every available channel in order to try to reach people as quickly as possible, because our ultimate goal is as many needles in as many arms as fast as possible.
Thank you. We'll go next to Denise Paglinawan from the Canadian Press. Go ahead, Denise.
Hi. Earlier, another reporter asked about outdoor activities. I'm wondering, Dr. de Villa and Mayor Tory, if you're considering issuing new guidelines on outdoor gatherings and the risks associated with them as the weather gets warmer.
So Denise, when it comes to outdoor activities in general, they are definitely lower risk for COVID-19 transmission than anything indoors, because the air volume is just that much bigger, and the likelihood of spread from one person to the next is definitely reduced when you're talking about big airspace, and especially air that's constantly moving, as is the case outside. So from a risk perspective, outdoors is always less risky. That doesn't mean it's no risk. And our advice at this time is still to try to maintain as much distance and to not interact with people with whom you don't live. And if you have to be outside, to really keep your distance and to ensure that you're wearing your mask as much as possible, especially if you're unable to maintain that 2 meter or 6 foot distance from others. So those are the general pieces of advice when it comes to risk. There is, of course, washing your hands, making sure that you're staying home if you're symptomatic and going to get yourself tested appropriately so as to minimize the risk of transmission. When it comes to the regulations and rules, those are actually set out, the gathering limits are set up by the provincial government under their existing framework. So that really is a question directed towards them, but I would say that risk is definitely reduced outdoors compared to that which happens indoors when you have people interacting with each other.
Thank you. And my second question, I know there's also been some mention about vaccination of 80 years old and older population. I'm wondering if they're going to start allowing them to book vaccines in Toronto before March 15.
Do you want to take that?
Sure. Natalie, we are limited right now and controlled by the availability of vaccine. And so really the answer to that question is entirely dependent upon the supply of vaccine down the chain. And I think it's important that we reiterate that chain. The Government of Canada is responsible for approving the vaccines and procuring them on a national basis. They then provide them and distribute them to the provinces. We in the City of Toronto receive our vaccine allocations from the Province of Ontario. The issue that we face today, and we have now for a number of weeks and for some time, is the availability of that vaccine. So the answer to your question, I'm not trying to be evasive in any means. The answer to your question is directly tied to the availability of vaccine. As vaccine availability improves, as more is allocated to the City of Toronto, we are, as we've described both in remarks and in response to questions, we have plans in place to make sure that we are ready to go as very soon as the vaccine can be made available to us by the province of Ontario.
Thank you, Chief. We'll go next to David Ryder from the Toronto Star. Dave, go ahead. Just need to unmute yourself there, Dave. If you're on a phone, it's star 66. There you go.
Hi. Yeah, I apologize. My phone glitched up there for a second. Hi, everybody. Can you tell me, Mayor Tory, since last week, it seems like there's real different messages on reopening and how quickly the GTHA should reopen from you and Mayor Crombie and other Peel Region mayors. Have you talked to them? Is there any chance that there will be some kind of common ground to the province, or is it going to be whichever municipality just says what they think is good for them and hope that it kind of all works out?
I have spoken with Mayors Crombie and Brown and Regional Chair, the Regional Chair of Peel, and all the mayors and chairs in the GTHA region. It does pose a challenge to have different restrictions in place in a region that has a common media market and that has a lot of mobility going on, and we've seen a lot of that even in the last week or so. Our job here in the City of Toronto, and I made mention of this earlier on, our job here is to sit together and to try and fashion a recommendation, a regime that works best for the City of Toronto. But that includes taking into account what's going on in the rest of the region. It includes, obviously, first and foremost, health concerns and health considerations. It includes the economy, and it includes the state of mind of the people we serve, who are the people of the City of Toronto. And so that's what we're doing. I think from the standpoint of simplicity and ease of understanding on the part of all the people in the region who all watch the same news and pick up a lot of the same information, it would be best if it was very similar information, but our job is to look after the interests of the people of the City of Toronto, and that's what we're doing.
Thank you. And following up on mayors and chairs, the news release from your call with the GTHA municipal leaders today says that all municipalities on the call, representing millions of people, are anxiously awaiting confirmation by the province that they will be compensated for the millions of dollars in expenditures involved in delivering the vaccinations. What is the province saying to municipalities about the significant costs in vaccinating their residents? And what is there an estimated cost for that campaign for Toronto?
An estimated cost yet, except to say it's going to be a lot of money. It's going to be millions upon millions of dollars. And the province, to be fair, has indicated that the public health aspects of the vaccination programs will be underwritten by them. And they've been very good in the past about other public health expenditures that have been undertaken. The question is, of course, where does the definition of public health begin and end? And so there's uncertainty about that in the minds of the municipalities, and they need to know, just because, again, we are required to balance our budgets each and every year. We have not provided for an extraordinary sum in the millions in Toronto's case that we don't expect to be reimbursed through public health or other health-related mechanisms, and we need to know, as do all the other municipalities, that will be taken on, as I believe properly should be the case by the province. So we're simply indicating that we'd like to have a greater and broader assurance as to all of these expenditures, really, that we're undertaking in partnership with them and on their behalf and for the same people to be looked after through the healthcare and the public health system.
Thank you. Final question is to Mike Crawley from CBC News. Go ahead, Mike.
Yes, hi. I guess this is to Dr. de Villa and maybe also to Councillor Cressy. You keep referring to this issue of this lack of supply of vaccine, but all public health units are getting vaccines. They're all dealing with the same, supply issues. And so, can I get a really clear, concise answer, hopefully, about why it is that York, which is right next door and has a fairly high population, is today vaccinating 80-plus-year-olds in the community, and we have no idea from everything you said today when Toronto is going to start vaccinating 80-plus-year-olds in the community?
Well, you know, Mike, I think one of the challenges that we experience here in Toronto is, you know, because we are such a large city, we have, for example, many healthcare institutions and many hospitals. You know, that's I guess a richness, and it is a strength for us as a city. However, as you look through the vaccination campaign, the COVID-19 vaccination campaign, it does mean that we have a significant number of people to actually cover as part of the provincial prioritization framework, which considers, importantly, healthcare workers who are working in direct contact with those who might have COVID-19 infections and who are also working in direct contact with those who are at highest risk for negative outcomes associated with COVID-19. So we have roughly, I believe, about 100,000 people working within the healthcare system here, and that doesn't exist in other jurisdictions. So that's just one example of the scale or the size and scope of the vaccination campaign that we need to undertake here in Toronto that differentiates us from other jurisdictions. Don't know whether Councillor Cressy has something further he'd like to add.
Yeah, I mean, I think, Mike, just very simply, the prioritization framework at the provincial level is based on vulnerability, and vaccine supply is distributed on a per capita basis. And so because of the unique situation and the uniqueness of Toronto, we have a disproportionately large number of people who qualify in phase one because they are more vulnerable. Dr. de Villa mentioned that we have 98,000 people working in hospitals. Other categories under the phase one priority list, we have 32,000 home care clients, 6,000 home and community care staff. We have 6,000 people working in the shelter and housing sector in the frontline healthcare response, and it goes on and on and on. And so it's a simple answer, really, which is the prioritization framework is based on vulnerability, but the vaccine supply distribution is a per capita basis. And so that's why you're seeing this.
And if I could just say, in discussions with my colleagues from the other municipalities, one or two of which you made reference to, they acknowledge the fact that they moved through the early stages of the priority much faster because they have fewer healthcare workers, fewer homeless, resident workers, and fewer of all those categories of priority people set by the provincial list, and were able to move then to the 80 plus within the context of the supply that they had because of the explanation just given by Councillor Cressy.
Why are police officers being vaccinated now? Because I thought they weren't until the essential workers phase two of the provincial timeframe. But Toronto police officers are being vaccinated starting today.
I think if you look at the provincial document that set out prioritization, it talked about medical first responders, which included people who go on medically related calls. And if you look at police officers performing CPR, police officers administering naloxone, you have not all of the police officers, but a certain number of them that are daily, in many respects, involved in that kind of a call, similar to the way firefighters are and similar to the way, obviously, that paramedics are. And so they're simply medical first responders as found in the provincial prioritization document.
All right, thank you very much for joining us. That concludes today's briefing. Our next scheduled update is this Wednesday, March the 3rd at 2 p.m. Stay well, everybody. Thank you.